Thank you, Daniel. I'm going to talk from the viewpoint of the dismal science of economics, just trying to highlight a bit the context in which those things that we discussed take place, and perhaps the complexities that undermine proper planning and decision making. You know, when you're dealing with health economics, your whole world is about two things: asymmetries and uncertainties. So the first part, of course, refers to the harsh reality of scarce resources compared to the infinite needs of the population. This actually translates to a very specific thing. It translates to the need to take decisions and actually plan those decisions in such a way that you don't serve those that come first, but serve those that have the highest need. This, of course, entails a series of decisions on what to provide, how to provide, and for whom to provide, of course, which in health is quite a peculiar thing because decisions in health need to be transparent, evidence-based, and open to critique. Why? Because, you know, public funds in health, and I'm going to specifically refer on this, are everybody's and nobody's at the same time. So we all put them in, but they do not belong to somebody in specific. So this mandates that a certain degree of accountability must be present. So this is especially relevant when it comes to health technologies, because health technologies, for example, novel medicines, is at the same time the key factor of longer and better lives, and also at the same time the key factor for healthcare expenditure, right? So you need to especially focus on how you deal with health technologies, and for this, it is essential to make a key distinction. All things that come to the market are new. Not all things that come to the market are innovative. So the idea here is to see which ones are innovative and reward this innovation. This is not just a motto, you know. This entails a specific process which you actually pay according to results. And those results come in the form of longevity, come in the form of productivity and quality of life. And those things can be measured. I'm really happy on what the minister just mentioned about the systems that are put in place to measure quality of life and satisfaction from the health services. This is a hugely important step towards the direction to find and reward through innovation. No matter, however, how well structured your decisions are, there is also a degree of uncertainty, especially in the field of health. Actually, if you think of it, in health, the only certainty is the presence of uncertainty. Probably this applies to life as well. But we should not treat this as paralyzing, right? We have the means to handle and control, of course, uncertainty. And of course, in health, the answer lies in data. This underlines all our initial statements here today. And of course, this highlights the need to systematically collect the data and use them, of course, to make decisions, especially when it comes to new technologies that enter the market. Of course, reevaluate our decisions when the time comes and when the data are more robust. If the data is not available at the time of a decision, then we have systems, research systems, and systems that guarantee access, for example, the strategies of innovation funds, to both secure access as well as foster research and build on human capital. So, in my point of view, I think that we need two structural and cultural changes in our system in order to promote the sustainability when it comes to assessing innovation. Of course, the first one is to build a solid decision-making systems and processes, actually, according to the best practices available and, of course, adapted to the local requirements. An emblematic reform here should be health technology assessment. This way, you can count your costs and benefits. The minister before actually mentioned the example of COVID vaccines. The Greek state for each €1 that's spent on COVID vaccines, got 4 in return. This was the scale of costs versus benefits for this type of innovation. And of course, the other part is that we should make a comprehensive data management strategy in order to provide the system with a function of evidence-based health policy. We should generate evidence at the patient and the system level, of course, systematically use them for decisions, systematically use the data for monitoring the process of implemented policies, something that we not systematically do, and use the data for planning according to our healthcare needs. And of course, as a final note, data should be made available to the scientific community and to everybody interested to analyze them and provide knowledge. You know, knowledge is actually public good, and it benefits everybody. Thank you.